You know, at some point we may need a specialist in so many different areas, and we want to pick one that has a great background, great history, a lot of experience. Orthopedic surgeons are one of them, because just about all of us at some point in time, we get older, whatever, we're going to need that shoulder surgery or knee surgery or something. Well, today on the show I have with me Dr. Philip Myers, who is with the Mississippi Orthopaedic Institute. Dr. Myers,
hey,
thanks for being on the show.
Here.
Thank you for being here with us. Give us a little background about yourself, if you would, please.
Well, I grew up in Sugar Land, Texas, and ended up going up to Kentucky for medical school and did a residency in Ohio and a orthopedic traumatology fellowship in Columbus, Ohio. And now I'm moving down to the coast here and looking really forward to serving the community here with my skills and my talents from a standpoint of what I learned in my training.
Why, I mean, there's so many different areas out there. Why orthopedic?
Well, my papa was a carpenter growing up, and orthopedic surgery is not unlike carpentry, just in a sterile environment. And instead of working on a house or a building or a car, you're working on the human body, but you're using all the same tools. You're using all the same screwdrivers and mallets and all those kind of things, but we do that on the human body.
I don't know about just the idea of somebody pounding on me all of a sudden with a mallet or a screwdriver. I get this vision in my head.
Yeah.
It doesn't go too well. What are, you think about orthopedic surgery. A friend of mine that I work with here is having surgery on his shoulder.
Sure.
Or I guess a rotator cuff or something like that, and you have knees. What are some of the areas that you deal with on a regular basis?
I would say the most common areas that we deal with are hips, knees, and shoulders are probably the most common areas for work in a reconstructive manner, meaning I have an injury and I need my rotator cuff fixed, or I need my knee replaced, or I need my hip replaced. From a accident-prone standpoint, when we have falls and when we have car accidents and things of this nature, we mostly work with wrists and ankles and hips as well with falls. So most commonly those are the things that we work with based on what your needs are.
Do you work with a lot of sports injuries?
Absolutely.
I would imagine. I was going to say, I
Absolutely.
mean, here it is, football season, and I'm sure any kind of season throughout the year. I mean, there are different types of injuries that you have to deal with when it comes to, athletes.
We've actually, sports medicine is a field that has grown immensely over the last 25, 30 years. And that has to do with the specialization of athletes now. Mm-hmm. We have kids that play baseball year round now, from the age of 6 years old all the way up until the age of 22. And when I was in high school, I played 3 or 4 different sports. So I didn't play one single sport all year. So the field of sports medicine has grown tremendously from a standpoint of understanding what kind of injuries people have when they play one sport year-round, mm-hmm. because the wear and tear on your body is so different.
Well, you mentioned the fact about the young people, and I have a dear friend of mine that has got a little boy. I say little, I've seen him grow up, mm-hmm. but and he started out very young playing the youth baseball, the youth football. Mm-hmm. Do you see many patients that you have to do orthopedic surgery on at that
Absolutely.
young age?
Absolutely. It's not uncommon to break bones on a regular basis, particularly with football and youth football. Certainly we see overuse injuries in young athletes. We didn't really understand how far we could push younger athletes because their body is so immature. But now that we have a better idea of how much they can tolerate from a normal mechanic standpoint, we know that we have pitch counts now, and we have mandatory rests, and we know how to rehab these injuries and the things that we need these athletes to do when they're not playing baseball or football to make sure that their body is in good enough shape to sustain that year round.
Well, that's why you see a lot of your major athletes, your big league athletes, like in baseball, they'll pitch a game and then they'll sit out a game or two because they've got to let that arm rest.
Exactly right. And the young athlete is even more susceptible to damage because their body just hasn't matured yet.
Mm-hmm. Do they seem to heal faster though?
Oh, absolutely.
Yeah.
Kids are like starfish. They can heal anything.
Break a leg off, it'll grow back.
Yep, they heal very well.
Now, somebody gets, I guess they go to their regular general practitioner, mm-hmm. First, and to get a referral or get a diagnosis as to a problem that may have?
It depends on what your insurance company is. A lot of insurance companies now, you can go see a specialist without having an official referral. Mm-hmm. But your family practice doctor or your primary care provider is always a great place to start. They have a wealth of knowledge. They can treat a lot of different problems, and you may not necessarily need to see me because I might not need to do surgery. So the primary care doctors and providers are excellent in that they have a good understanding of where to start, and if that doesn't work, then they may knock on my door.
Mm-hmm. What are some of the things now as people get older, you know, and more mature, let's say more mature, I like to use that term, more mature in age, because I'm up there now, I'm 63 years old, so you know, every now and then you get that knee popping thing or whatever. Is there signs that we should watch for that maybe says, I might not need to, you know, before it gets too bad?
I like to follow a 2-week rule. If something bothers you for 2 weeks, it's not getting better after 2 weeks, despite the things that you have done on your own, just resting and maybe icing or taking some anti-inflammatories or some Tylenol. I like to follow a 2-week rule. If something's not getting better or turning the corner by 2 weeks, it's usually a good idea to ask maybe your primary care provider or something, or if you already are established with an orthopedic surgeon, to give him or her a call and say, hey, you know, this isn't really working right, you know, can I come in and see you? And at that point there may or may not be something that we need to do. However, it gives us a baseline for where we're at and where we may need to look towards in the future.
Tell us about the Mississippi Orthopaedic Institute and why you chose to work with them.
Well, I'm joining a great practice with a sterling reputation. Part of what drew me to this practice is that everybody treats one another like family. All the providers, all the staff are friendly, and everybody has the mindset that we're here to take care of people. We don't take care of patients, we take care of people. You know, and there's a much greater personal touch to everybody's attitude there, and I'm very drawn to that because I am a big fish, small pond kind of person. I like being in an area where we can really make a difference, and a nice small family-oriented practice is just a great opportunity to be able to really come in and make a compassionate difference.
Now, I guess if somebody's having some issues, like you said, check with your insurance company. You may not necessarily need a referral from your general practitioner.
Sure.
That 2-week rule is very important, especially those of us, as I said, are getting on up there in a few years. But if you're you know, having some issues, that what they can do is call and make an appointment. Now, you're located in the medical building right next door to Garden Park.
Yes, sir.
On the first floor. You walk in the front door, you just straight on back.
Right ahead.
And that's where you are. I have some friends that work there as well.
Oh,
so,
good.
Good. I know exactly where you are. Anyway, Dr. Myers, welcome to the Gulf Coast.
Thank you so much.
Glad to have you down here. And again, if you you know, if you're having some issues with you know, your knees or your shoulders or whatever, you think you need a good orthopedic surgeon, give them a call at the Mississippi Orthopaedic Institute in Gulfport. Thank you.